Euthanasia, which is also known as assisted suicide, physician-assisted suicide, and in more loosely terms, mercy killing. It is derived from the Greek words meaning good death. Some may interpret euthanasia as the practice of ending life in a painless manner. A person who undergoes euthanasia usually has an incurable condition, but there are other instances where some people want their life to be ended, and in many cases it is carried out at the person's request. The issue whether human beings and doctors have the right to help others die has been in the public discourse since before the birth of Christ. It is believed that euthanasia started in the ancient Greece and Rome around the 5th century BC. Although a Hippocratic oath prohibited doctors from giving a deadly drug to anyone, not even if asked for, few ancient Greek physicians followed the oath. Euthanasia has two classifications: voluntary euthanasia, which is conducted with consent, and involuntary euthanasia, which is conducted without consent. The two procedural classifications of euthanasia are passive euthanasia, when the life-sustaining treatments are withheld, and active euthanasia, when lethal substances are used to end the patient's life. There are other options aside from euthanasia, such as palliative care, which strives to offer a support system to help patients live their remaining time as actively as they can, and to help families deal with the illness of their loved ones. Most religions disapprove of euthanasia. Some of them absolutely forbid it. The Roman Catholic Church, for example, is one of the most active in opposing euthanasia. Virtually all religions state that those who become vulnerable through illness or disability deserve special care and protection and the proper end-of-life care. Is euthanasia ever morally acceptable? This has always been an ongoing argument, and because people have different opinions and different beliefs, this question may never have a defined answer. Many may argue that it is natural for us to want to prevent whom we love from suffering unnecessarily, but others argue that life is sacred and we should always seek to protect life. As of April 2002, the Netherlands became the first country to legalize euthanasia and assisted suicide, along with Belgium, Ireland, Colombia, and Luxembourg. In the United States, Oregon was the first state to legalize assisted suicide. Following was Washington, Vermont, Montana, and California. On October 27, 1997, Oregon enacted the Death with Dignity Act, which allows individuals who are terminally ill and likely to die within 6 months to end their lives through voluntarily self-administration of lethal medications prescribed by physicians. Euthanasia raises a number of agonizing moral dilemmas. But at the heart of these arguments are the different ideas that people have about the meaning and value of human existence. Should human beings have the right to decide on issues of life and death? Some people think that euthanasia shouldn't be allowed, even if it was morally right, because it could be abused and used as a cover for murder. In 2013, the Pew Research Center reported on Americans' attitudes toward euthanasia and assisted suicide. The center found that more than 60% of Americans believe people suffering from severe pain with no hope of improvement have a moral right to end their lives. Autonomy is certainly valued in modern society, and patients do and should have the right to accept and reject medical treatment. However, those who favor assisted suicide claim that autonomy extends to the right of a patient to decide when, where, how, and why to die. The choice made by an individual should be considered in terms of beliefs and values of the dying individual and his or her family. For example, in Western medical systems, the principles of individual autonomy and informed consent are primary. As mentioned before, euthanasia is defined as good death. But what exactly is good death? Some explain it to be as painless, lucid, peaceful, and surrounded by loved ones. Brittany Maynard was diagnosed with brain cancer at the age of 29 and was told she had 6 months to live. Maynard and her husband drew national attention when the couple announced they intended to take advantage of Oregon's Death with Dignity law. The couple had relocated to Oregon from California specifically for the law. Retired French teacher Chantal, who who was diagnosed with a rare form of cancer of which only 200 cases have been reported, refused any treatment at the time. Not wishing to take the risk of the surgery or medications, she fought for the right to die through euthanasia. 14-year-old Valentina Marrera from Chile, who was diagnosed with cystic fibrosis as a baby, published an emotional video on her Facebook page pleading her country's president for permission to end her life. In 2012, a pair of identical twins, Mark and Eddie, who were born deaf, were killed by Belgian doctors after seeking euthanasia when they found out they would also soon go blind. Laws on assisted suicide and euthanasia, such as the one in Oregon, include conditions or requirements limiting assisted suicide to certain groups of qualified patients. A patient qualified to receive the treatment of assisted suicide must be an adult who is capable of making their own decisions and must be diagnosed with terminal condition. Some believe that euthanasia needs to be legalized, while others believe that euthanasia is unacceptable. The problem whether to legalize euthanasia or not revolves around multiple moral, ethical, and socio-economic issues.